So this jersey generated a few comments on my last post, and so I figured I would just go ahead and wear it while I answer questions. So treatment options is going to depend a lot on what your goals of treatment are. But generally speaking, treatment for adenomyosis kind of falls into two main buckets. Medications can be used for palliation of symptoms, and then there are surgical options. So medications could be things like hormone therapy or birth control. And again, the aim is at palliation, meaning that it's really aimed towards symptom control. The progesterone IUD can sometimes be a great treatment option and may work for some folks. In the surgery realm, hysterectomy removes the uterus, and when there's no longer a uterus, there can't be any adenomyosis. Now, aside from hysterectomy, there is another surgical procedure called an adenomyomectomy. Now, that may sound familiar because the term myomectomy is the surgical procedure where a fibroid is removed from the wall of the uterus and the uterus stays behind. Similar to that, an adenomyomectomy is focused on removing focal areas of adenomyosis. So sometimes this can be an option for folks who have focal adenomyosis instead of global adenomyosis, although theoretically you could attempt to do an adenomyomectomy in a setting of global adenomyosis, but you'd kind of have to pick and choose where you think the worst disease is in order to go after that. Now, this is not a procedure that's very commonly performed. There's a lot of risk associated with it. There's really no plane in between the normal uterus and the adenomyosis because adenomyosis infiltrates or goes and snakes into the normal cells of the uterus. So this is usually a procedure that has to have a lot of counseling behind it. Typically is undertaken in concert, in collaboration between a surgeon and a fertility physician. So a lot of times these are patients that are wanting to preserve their uterus to potentially be able to get pregnant in the future.